Back in 2016, then Governor Butch Otter asked the State Board of Education to get together with the state's medical community and colleges to come up with a plan to address how to get and keep more doctors here in Idaho. The reason, at that time, we were 49th out of the 50 states when it came to physicians per 100,000 people in the state. At the time, we were also 49th out of 50 in the number of medical residents per capita. Residency is those 3 to 5 years a medical student spends after graduating from medical school. You know, those times, that year, I should say, or 3 years, learning how to be a doctor. In Idaho, most of those programs do last 3 years, when med students work under supervised training and when they become board certified. And where those med students spend their residency years, well, that matters. Here's how Dr. Ted Epperly explained it to the Joint Finance and Appropriations Committee in January of 2018.
Now, why this becomes particularly important is that the retention of a physician is enhanced by where they do their residency programs. The data is really clear on this, that 50 to 75% of graduating resident physicians will stay within 50 to 100 miles of where they train.
Dr. Epperly knows what he's talking about as the president and CEO of the Family Medicine Residency of Idaho, a federally qualified teaching health center here in Boise, which also focuses on rural training across the state, which is why he was put on this medical education committee in the first place and tasked with coming up with a plan to increase Idaho's physician ratio. Back in 2018, during that presentation to JFAC, Dr. Epperly threw out several stats and what the committee hoped to do to improve them. They wanted to take Idaho's residency programs, which at the time was just 9 in the entire state. They wanted to increase it to 21. They wanted to increase the fellowship programs from 4 to 9. They wanted to grow Idaho's residents and fellows from 141 to 356. They wanted to graduate 124 physicians from Idaho's residency programs per year instead of just 52. Doing this would take us from 6.7 residents per 100,000 people to 17.7, basically tripling our output, but still well shy of the national average of 28.1. But hitting that mark would make Idaho 41st instead of 49th. In turn, more residency students in Idaho might mean more doctors stay in Idaho. The goal was to produce 2,000 physicians for the Gem State and keep half of them here. And they wanted to do that, all of this, within 10 years. So here we are, about halfway through that 10-year plan. And according to the 2022 Graduate Medical Education Committee report, well, we have certainly improved. Our residency programs have increased from 9 to 12. Fellowship programs from 4 to 8, and the number of resident students has increased 77% from 134 to 237. And that all sounds great, but Idaho has only improved its standing from 49th to 45th in doctors per 100,000 people. And as for those in residency, those in that program, we've only gone from 49th to 47th in the country. Why? Well, mostly because Idaho's population has jumped a lot more than those 2018 estimates anticipated. But the silver lining in all this is the advances this committee and this plan have made, including creating more residency opportunities, like the first of its kind in Idaho, pediatric residency program. Here's Andrew Bartline.
Part of the practice of a pediatrician is finishing what you've started.
So the remeasurement was lower? Mm-hmm. Okay. That's always a good first step, so that's great.
Savani Kiravana is a new resident at Full Circle Health. She's the first of 4 in total.
Yep, got it.
To capstone the home stretch of her education.
Hi, good morning.
In the Gem State.
I love being here.
But the home stretch here is far from her home.
So I am originally from India. I was born in India, and then I was raised in Mason, Ohio, for a decade before I moved back to India with my family. That's where I lived for the past 15 years, and yeah, that's where I went to med school.
In Boise, she'll get a specialized working knowledge.
But weight for length has meaning.
Under the watch of Full Circle Health.
It's been an honor.
With program director, Dr. Perry Brown.
This was about a 4-year project to get to the point that we could actually welcome our first residents.
How unique is that to have a pediatrics residency here in Idaho?
Well, it's unique enough that this is the first one that's ever existed in the state. So there's a pediatrics residency in Seattle, and there's one in Portland. And if you drive east from the Pacific coast, the next one you hit is at the Minnesota border 1,400 miles later. We're the first one in that entire gap.
That sounds problematic to me.
It is. It's one of the reasons why Idaho ranks 50th in the U.S. in terms of number of pediatricians per 100,000 children.
This residency program aims to be the solution because numbers show where a doctor completes their residency is where they're most likely to practice.
And this is how we start improving our access to pediatricians here in this state.
It's access that's needed, and Full Circle knows firsthand.
Sometimes they're driving 3 hours to see the closest pediatrician.
Do you see that? Are people coming down from Weiser to come see you at this Full Circle Health Clinic?
Yes, yes.
Which is why the program points specifically at these pediatrician-poor areas.
During the interview too, they told us that in our first, second, and third years, we're going to be rotating at a rural location.
They're going to get trained in places like Haley, Twin Falls, Fruitland, etc. And by doing that, we anticipate that they're going to fall in love with some of these places. They're going to decide to remain in some of those places and practice.
It's intentional to trace the outline in the namesake, to find physicians who want to finish what they started.
That's, I think, special towards pediatrics because you see them grow and you don't want to suddenly just leave after 3 years.
It's early, but Savani already sees how it could connect back to her new beginnings.
It's only been 4 weeks since I came here and I already feel like I want to just be here for the rest of my life. I don't think that is a very surprising statistic.
Dr. Brown says he was originally concerned about attracting quality candidates for a brand new residency program, especially ones that will put a focus, or especially a program rather, that would put a focus on rural practice. He found that not to be a problem, and they're already starting the process of recruiting for matches to fill that next class. It could actually be an advantage too, Brian. When we talked with Savani, she said, I wanted something like this. I wanted to be in a more remote, rural area and get that experience. So they're finding quality candidates who fill out exactly what the state needs, and she might be a good example 3 years from now of somebody who sticks around, stays, and helps these numbers go up.
I know, we were talking during that story, it's interesting the state's forcing some women to have their children, but when it comes to finding doctors for those kids, that might be a little tougher. I found it interesting during Dr. Epperle's presentation in 2018, he talked about the financial impact of this, that $1.3 million in revenue for every doctor that stays here in Idaho, the state will get. So if they get 1,000 doctors to stay here, that's $1.3 billion that the state will see, plus 10,000, or 10, I should say, 10 new jobs, 10,000 new jobs that come along with that for all those people. So it's a big financial benefit to make them or have them stay here in Idaho after fulfilling their residency.
And there's a big effort to do it, 10-year plan, halfway through it.
Exactly. All right. Thanks, Andrew.